Today we are discussing a rare disease called Spinal Muscular Atrophy or SMA with Dr. Neelu Desai. Dr. Desai is a child neurologist in Mumbai with more than 12 years of experience in the field and has a keen interest in managing children with refractory epilepsy, demyelinating disorders, and cerebral palsy. Thank you for joining us today, doctor. So to begin with, can you tell us a little about spinal muscular atrophy? What is it and how many people does it affect?
Spinal muscular atrophy is a rare genetic disorder, which is children, around 1 in 8 to 10,000 children are affected by it. And across India, there may be around some 500 to 700 patients who are affected with spinal muscular atrophy. It occurs due to a defective gene. There is a gene defect which the parents carry, but probably they have it in a very small amount, so they are not affected. But if both the parents carry that defective gene, they can transmit it into their offsprings in double the amount, and because of which the child may suffer from the disease. Because of this defective gene, the problems with the child has is delayed motor milestones. They may have difficulty in moving their limbs. Sometimes it may involve their breathing and also their feeding and swallowing. So there are variations in the presentation. Some of them present right in the newborn period, or sometimes called as type 0 SMA. Some present in first 6 months of life, type 1 SMA. Then there are others which may come later, after 6 months, 1 year, some even after 2, 3 years, which are type 2 and type 3 SMA. And there is one rare adult onset type 4 SMA. So these are the various variations which we see in this disorder.
So when it comes to India, how common is SMA and is there enough awareness about it?
So it's, as I said, it's not very common, but at the same time, it's not very rare also. So we do come across SMA patients often. And as I said, 6,000 to 8,000, or sometimes even 1 in 10,000 children may be affected. Awareness about this disease was lacking a few years back completely. But in last couple of years, I think the awareness has markedly increased because of a very active parent support group called as Cure SMA, and a lot of new medicines which have come in treatment in the market, and few of them have now available in India also. So because of which this awareness, people are coming to know about this disease. Though a few years back, if I think, no one knew what SMA was. But now more and more people are coming to know, even the medical fraternity and even the general population is getting aware because of the disease, because of some campaigns, because of the very expensive drugs, one of the costliest medicines in the world, which has been approved for this disease. So people are coming to know because there are some crowdfunding agencies also which are trying to sponsor these medicines. So it's there all over. So now people are coming to know, though a couple of years back, no one knew what is SMA.
When it comes to the treatment of SMA, doctor, how does SMA get diagnosed and what are the symptoms to look out for?
As I mentioned initially, they depending on which type of SMA, some of them may present right in the first few months of life with failure to move their limbs, sometimes breathing difficulties, sometimes feeding difficulties. And there are others which come later with delayed motor milestones, not able to stand, not able to sit. And it's more physical complaints. These children are mentally normal. Very often, a child neurologist may be able to diagnose it clinically itself. And to confirm their diagnosis, they may ask for a genetic test. They look out for the genetic mutation. Sometimes, if not sure, they may ask for some nerve conduction studies, EMG, electromyography, to confirm their diagnosis. But very often clinical, sometimes helped by genetic diagnosis, can lead to the confirmation of SMA.
Since you said that the awareness is slowly coming in India relating to this, so what are the government policies or interventions related to SMA currently and how can people avail them?
There are not much help or anything by government as of now. The only thing recently which we came to know that we have the drug, the gene therapy costing around 16 crore, which we had to import from US and had a GST of around 4-5 crores. That has been waived off. And some of the drugs like Risdiplam and all are now available in India. They have got approval to be available in India. So we can write down a prescription and patient can buy and everything need not be imported. Besides this, there's not much. In fact, some of these medicines are very, very expensive. Those working in public sector, some of the patients whom I had who were government servants, they had support of their company sponsoring. They did help them. They were in process of acquiring. So none of them has received as of now. But some government agencies are helping monetarily also, helping their employees if they have children with this disorder to acquire the funds. Otherwise, it's not a uniform thing. It's not that we are getting patients are getting any aids from government, because the medicines, as you know, they have recently come and they cost a huge amount. It's like the most expensive drug, 2.1 million US dollars, which amounts to 15, 16, 17 crores of Indian rupees. And the other medicines also which are available, they're around 5 to 10. Some of them are to be continued lifelong, so around 3-4 crore per year. Even the richest of rich people will not be able to afford this for lifelong. So compared to the cost, there has not been much assistance by the government. But I think the SMA Society is working closely and trying to get supports and some trying to work out if there can be some funding by the government, part funding or full funding based on the paying capacity of the patient. So nothing has come except for the GST waiver.
So like you mentioned that the treatment is really expensive. So can you like take us through the treatment procedure and what a patient's life is with SMA? Because a lot of people don't know even about the existence of it.
Yeah. So SMA people, as I mentioned, the problems they have is basically movement, mobility. They're not able to walk, they're not able to sit, depending on how severe it. And some of them with the most severe form are not able to breathe or eat on their own, and they need support for all of this. Now, this is the milder ones, may be wheelchair bound throughout life, and the severe ones may be ventilator or feeding support dependent. Severe ones may die by 1 to 2 years of life, while the less severe may survive for many years with a lot of disability. This is what the journey of a patient with SMA is. Now, 5 years back, there was absolutely no treatment except for rehabilitation, giving them physiotherapy, supportive treatment, immunizing them with vaccination so that they don't get recurrent pneumonias. Since these children have breathing problems, they have weak respiratory muscles, they were more prone for getting chest infections, and they would get admitted repeatedly. They would have swallowing problem, because of which they will aspirate, and this food would go in the lungs and cause again aspiration pneumonias. Then they also had a lot of orthopedic issues, contractures, scoliosis, spine problems, and all these issues, which though they were all mentally normal, intelligence wise they were quite good. So even that was even more troublesome, because they could understand the disability what they are going through. They could see that, yeah, they are not able to walk, they're not able to sit, they're not able to use their hands and legs. So it was even more painful. Now in last 3-4 years there have been three remarkable drugs, landmark discoveries which have happened. So first is a gene therapy, which would directly hit at the defective gene. So you give it with a virus vector, and that gene, the correct gene, would replace the defective gene and start producing the protein, that is the SMN protein, which is lacking in patients of SMA. So slowly this will take over normal SMN protein synthesis. Should take over the function, but the results are best when it is given very early, before the disability has started. So in the first 3 months or first 6 months, where in our country, many of SMA patients are not even diagnosed by then. So the results are best when you give it very early with gene therapy. Same is with the other two medicines. One is an intrathecal injection, which has to be given every 3 to 4 months for lifelong. And it has to be given in the spine. So it has to be a very specialized procedure, has to be admitted, patient has to be under observation. And those who are having a spine deformity like scoliosis, it may be technically challenging. Again, it's also very expensive and not available in India. Both the treatments which I have told are not yet available. Either you apply through some charity fund or through some lottery system program, which the companies are having, or people are generating some crowdfunding and trying to generate such phenomenal amounts of fund through charity portals. Now, the third drug which is available is an oral daily treatment, lifelong. The advantage is that it can be given orally, and it can be started as early as 2 months of age and can be continued for lifelong. And now, fortunately, it's also available in India, so you don't have to import it, and all those importing hurdles are taken care of. So these are the three medicines. All of them, if started early, can have good results, have shown, world literature has shown that the results are good if they are started early. adopted early.
Going into day-to-day lives, doctor, what kind of support does an SMA patient require? And how do you think we can understand this disease better and support them?
So the support which they require is depending on the severity. As I said, the severe ones will require ventilator support, feeding support, nursing support. They are not mobile, so everything has to be done for them. The less severe will be wheelchair bound. They maybe needing support to walk around, all these things, and recurrent infections may happen. All these are the problems which they will have. And I think as general population, whatever help they can give, if they are seeing such patients, whatever help, supportive function they can help. And if they come to know crowdfunding or something, if they can help in that, I think that is what a local population can do for them.
And going forward, what kind of developments can we expect in the field of SMA, in either the research or the treatment? Is there enough being done to get easier access to the treatment or awareness of the disease? If not, then how can we help bridge the gap?
I think we are going to a positive note, and I think since there have drugs which have come up, they were not even available in India. Now slowly this is available, and more and more research is going on. So I think the positive side would be if the costs are reduced, so that it becomes more available to the common people. The second positive side would be if government help is there, partial aid or some reduced price can be done from the company for developing countries. So that may be another thing. And more early diagnosis, newborn screening, where the diagnosis of the disease is done right at newborn period. So if you give the treatment at that stage, the results are the best. If you give it after 6 months, after 1 year, after 2 years, the results may not be 100%. But research has shown earlier you give the medicines, the treatment, the results are the best. So these 2-3 aspects, if they are taken care of, the care of these patients and SMA will have a positive outlook. These doctors need to know that how to diagnose it early, and that many people may not know that these options are available. So as soon as you diagnose, they should be counseled about these treatment options. And the approach, some of them have cut off, like the gene therapy is not yet approved after 2 years. So as soon as you diagnose, you should make sure that if it's possible, they can be given the gene therapy or the oral medicines wherever they are available as soon as possible. I think that needs to be known to the medical fraternity as well as the general population and the SMA population.
Thank you so much for joining us, doctor, and sharing such valuable information about SMA, something that requires immediate attention and awareness.